So looking at growth to me, I think is looking at not only just weight, which I think parents are all interested. Every day they come in, they want to know the weight, the weight, the weight. But looking at that on a weekly basis, as well as looking at head circumference and length, I think is really important to get the overall picture.
I agree. We implemented length boards not too long ago, just to make sure we were getting accurate measurements with our lengths. We had a problem with infants shrinking from week to week, so now we use the length boards. And when I look at overall weight gain, which we do have goals, but I'm also looking at that growth chart to see where they're falling on their curve, because I think they can gain within your goal range but maybe still fall off the curve, or gain below your goal range and actually you'll find that they're climbing on that curve. So I think it's important to really look at the baby and see what their trend is on that growth chart.
Yes, I agree. And in addition to daily weights and then weekly weight, length, head circumference, we're thinking about incorporating mid-arm circumference. Some babies, it's very difficult to determine adequate growth depending on weight fluctuations, especially babies prone towards fluid retention. Or perhaps their linear growth is compromised because of less movement. Particularly sometimes BPD babies have struggles with adequate linear growth. So the mid-upper arm circumference can be another measurement to help assess adequate growth or not.
And I think also using the pedia tools, the growth velocity, and looking at that on a weekly average basis helps with looking at their long-term growth from week to week, and seeing that we are keeping them on their curve, if not going up on those percentiles. So in addition, also looking at the growth velocity for a week based on their weekly gains, you can look at from one week to the next. And looking at Z-scores I think is really important and really helps us with our malnutrition screening, which I think is the next level in the actual growth.
We monitor growth in cardiac infants via multiple methods. Of course, you have your daily weights that we're looking at and weight for age Z-scores. But oftentimes in cardiac infants, because of changes in fluid, weight is not always accurate. And so it's really important that we also look at length, using length boards, as well as the changes in your length Z-scores and your weight for age Z-scores. Certainly, we're looking at the proportionality of the weight to the length, so your weight for length Z-scores. And very often, we monitor and utilize the mid-upper arm circumferences in our cardiac infants and babies. We can see certainly shift in the changes in fat mass depending on the cardiac defect that they have.